Hey guys, welcome to the Unleash podcast brought to you by Hidden Gen, where we talk about how to unleash your hidden potential. I'm your host, Yuri the Audience, and we have a great episode for you today featuring Dr. Mark Mathis. Thank you for being on today, Dr. Mark.
Thank you for having me.
Absolutely. So, before we jump into today's topics, we would like to invite you to subscribe to this podcast on YouTube, Apple Podcasts, or Spotify. Also, you can always find all these episodes at Hidden Gen website, hiddengen.net. And if you live in the area and you have not been at Hidden Gen, you can always grab a free trial pass on the website, hiddengen.net, and give it a try. Dr. Mark, I talked one of with in a previous episode with Dr. Alex. I guess y'all work together, right?
Yes, we're business
Yeah.
partners.
So give a little bit about your background and how you start into what you do today.
So long story short, I was a kid and I overheard someone talking about the profession of chiropractic. And although I didn't know exactly what they did, um, I thought because it was so different from what I was used to hearing about that it would be something that I look into when I got older. And when I was finally exposed to it, I realized that it was something that I connected with on a very personal level.
Hmm.
And I truly believe that the body has the ability to heal itself if we would just take care of it the way that we should. And so, just understanding the philosophy and the principles that chiropractic are based upon, when I was exposed to it, I knew wholeheartedly that it was a career that I wanted to pursue.
Okay. Okay. And how long you been doing that?
So we'll say going on 4 years.
4 years.
Mhm.
Uh, when you touch on this point of the body can heal itself, is that the kind of the foundation of what you do? Is just make sure that you are doing the right adjustments so the body can heal itself, or there are more into this?
Right. So the way that we look at it is if there's a misalignment within the spine, it causes an interference within the nervous system, and the nervous system is how the body functions. And so, if we can remove that interference, then we can help restore function within the body so that it can, once again, function the way that it's supposed to.
And a lot of people don't really realize how important it is to be fully aligned. And what would you say for that people that are very skeptical about going to do alignment because they think, well, I don't really believe this. I'm fine. I'm aligned, but they never done an alignment, right? So,
Mhm.
how do you entice those people to make sure that they understand the importance of proper alignment?
So, something that I like to educate patients on often, as well as those who aren't patients, is letting them know that you don't have to experience pain in order to see a chiropractor. Um,
Good point. Yeah, that's a
you
good
know,
point.
it's
Yeah.
yeah, and so especially considering the body does not only express dysfunction via pain, and so if something feels abnormal or out of whack, sure that's a good time to, but also just understanding the body is meant to move, and many of us either we are in careers or we're involved in sports, whatever it may be, where we do repetitive movements or where we're in the same position. We're sitting all day, we're standing all day, um, but whatever that may be, it's very beneficial to make sure that we're keeping those joints moving well.
There is any particular part of the body that you usually get more disalignment? Is it the back? It is the neck? I mean, with your experience, what is the main parts that usually is the ones that people complain most?
So I'd say low back, honestly, and actually, if anyone listening to this may or may not follow our business page, Ignite Health _ Wellness. Um, we actually recently posted a reel showing that one of the most common reasons that a male with low back pain may experience that is because he sits on his wallet or money clip, or a female may sit with her legs crossed too often.
Mm.
And once again, that contributes to low back pain. Why? Because it throws off the balance of the pelvis. And so, yes, more commonly we do get low back pain as a complaint, but also something that we take the opportunity to educate patients on is that the spine functions as a unit. And so, even though we may get a low back complaint, we're still going to address the neck as well, because after we assess and we look, most times when people do have low back pain, they probably have forward head posture. A lot of us look down a lot. We have poor posture whenever we're working or we're texting, certain things like that. And so, as the neck is in that forward posture, the rest of the spine may follow. And even though, once again, you may not be experiencing pain within the neck, because you've had that poor posture, it's affected everything below it as well.
Yeah, yeah, it makes sense. And mainly nowadays, everyone is looking down to the smartphone, so the neck
Right.
is very affected. And even for people that are very active on the gym, at some point they start develop some patterns.
Mm-hmm.
So that's where I believe it helps a lot as well.
Mm-hmm.
And touching on this of even for active people that are going to the gym and exercising, what is the advantage uh, from the performance perspective to do alignments?
Yeah. So, once again, the body is designed to move. Um, the thing with, here at Hidden Gym, we have the opportunity to treat various types of athletes. Whether that be those who are engaging in, active sports, or, they're powerlifters, bodybuilders, Olympic lifters, CrossFitters, whatever it may be. Um, Oftentimes we may find that, that repetitive movement or all of the stress we're putting on the joints, it can be overwhelming. And so, getting that proper motion restored into the joints by your chiropractor can help you with longevity as far as that performance goes. And yeah, I mean, pretty much just considering the fact that also we may lose technique. A lot of times people don't realize that they have imbalances and they may be practicing improper biomechanics.
Hmm.
A chiropractor can help assist them in making sure that that's performed correctly.
As far as injury prevention, proper alignment also helps to prevent injuries.
Absolutely. Yeah, that's a great question. So, um, if you look at it, once again, most people do have the misconception that you do need to be in pain, and something needs to be perceivably wrong.
Hmm.
But at the same time, if honestly, if we treated it from a prevention standpoint, so many of us will function much better than we do. And so, if you can address the issue either before it develops or even before it progresses, then yes, it can definitely be more beneficial to be on top of it instead of trying to fix the issue after the fact.
Makes sense. And how do you educate your clients that are afraid of performing alignments? Because a lot of people, myself included in the past, I was very afraid of those pops. I didn't feel really comfortable. Every time that I sit on the table, the guy was like, well, relax. And I couldn't relax because I was expecting that pop to come. And mainly on
Right.
the neck, I felt like it's going to kill me with this turn. So,
Right.
how you educate the listeners that are listening to this episode to say, hey, we are not going to break your neck, you know?
So, so first off, I would like to say that I could understand the fear in that. It's not every day that you have your neck in someone's hands. And films don't help because most times if you see someone's hands around someone's neck, they're probably getting hurt. So, with that being said, we're trained to take the neck to a point where um, we know that it can't be injured. And so, there are barriers, that we're educated on when we're in school, and we know that right barrier to take the neck to where it's like, okay, this is the point of relief, as opposed to taking it past that point where we can cause injury. And so, a big thing with that, one thing to point out, there are multiple techniques. And so, if you can't relax with that technique, we'll find another way to get movement within that area to where you may be more prone to relaxing. Also, um, if you find that you're tensing up too much, it can make it more difficult. That's typically one of the main reasons people find themselves being injured, if anything, with a neck adjustment, is because they tensed up and you're fighting against what the chiropractor is doing.
Yeah.
And so, if you could just allow yourself to take a deep breath, relax, which we typically guide you through, then it can be a very comfortable experience.
Yeah, that's an interesting point. Is that breaking that barrier of being tense, because being tense really doesn't help you to do your job.
Absolutely.
Do
Absolutely.
you get a lot of
Yeah.
this type of scenario?
Yeah. Yeah, absolutely. In every area, because I mean, obviously, we do full spine, and we also do extremities. The arms and the legs, and all associated joints. And so, um, a lot of times, if you can't relax, then yeah, once again, it's like we're fighting against one another. And I've, I guess you could say, I've enjoyed being able to make someone aware of their inability to relax. And then once they see that, taking a deep breath, letting everything relax, let everything go, how easy it is to get that adjustment.
While this is your specialty there, you do much more than just this, right? There are other type of treatments that you do as well. Can you list some of those other treatments that you do?
Yeah, I'm glad you asked that because one of the things that you asked about was, some of the benefits of coming in if you're an athlete
Mm-hmm.
or, if you work out on a regular rather. So we're really big into therapeutic exercises. And the idea with that is to assess and address those imbalances that we may find. And so once we, can do that between the chiropractic adjustment and those therapeutic exercises, we find that it's very effective in helping restore that patient's function. Well, outside of that, we do scraping, we do cupping, we do ART, which is an abbreviation for active release technique. And then we do some passive stretching for patients as well. And even with that, yes, we'll stress the patients out themselves, ourselves, I'm sorry, but we'll also educate them on how to do it for themselves away from us. Because one thing we don't want to do, we don't want to send them away from the treatment without some type of knowledge, that they didn't come in with originally.
Mm-hmm. You mentioned active. What is the name again? Active?
Active release
Yeah.
technique.
What is that? Because I heard that before.
Mhm. Yeah, so long story short, what we're doing is we're shortening the muscle or contracting the muscle in a sense, and the chiropractor or whomever is performing the service, what we'll do, we'll pin that muscle and we'll have the patient stretch in the opposite direction. And so there's just a different approach in allowing blood flow to get to the muscle properly and allowing it to relax and then moving forward engage the way that it needs to later.
And what is the purpose of this type of treatment? Is
Oh yeah, so I mean, ultimately, the purpose of any treatment we do is to restore proper function to that area. Um,
no, but
Most
I
of the
guess the
things,
question is, how do you define that this is the technique that you need to use for the scenario that the client comes up with, right? Like I come up with, look, I have this type of pain, blah blah blah. How do you
right?
determine that this is the best treatment?
Yeah, great question. So, um, I feel like we get that a lot. How often should you do this? When should you do that? There's no textbook answer, and so that's when it's left up to us to see who's going to benefit more from what. And everyone's body is different. We don't all respond the same way to the same things. And so we've had some who have responded great to cupping, some who respond much better to ART, some who respond better to just using a massage gun.
Hmm.
So it just depends on the person. And then also it depends on the injury that we're addressing, if it's acute, if it's chronic, so forth. And so it's really just an individual basis that we treat it by.
So if it is just a scenario of like recovery, now I don't feel any pain. You did your assessment and you saw that as far as alignment, I'm fine. What would be a good treatment to just have this body recover, to allow the body to recover faster and things like that?
So um, most times an adjustment is always effective. We do need to be able to know when it's necessary. You definitely don't want to over adjust the patient,
Hmm.
but most times that's always effective. And then just stretching, foam rolling, doing things like getting massages, doing those self care things, that the body can benefit from on a regular.
Yeah, I think that I asked this question because I was under the impression that cupping is a good technique for recovery. I mean, everyone talks about cupping, and when they talk about cupping, is they always mention recovery. So I was trying to understand what would be one good reason to do cupping.
So there are multiple benefits of cupping, actually. Um, it doesn't necessarily have to be for the sake of recovery, but as far as what we typically do it for, yes, it is. If someone is experiencing some type of tension in the area, um, or something we do as well, we do muscle tests. And so, in doing a muscle test, you notice that the area is weak. What that cupping can do is improve blood flow to the area so that the muscles can engage the way that it should.
Mm, okay.
So it doesn't. Once again, it doesn't have to be. Um, okay, so going back to a question that you asked about prevention. If you're not getting proper blood flow to an area, and you notice, oh, this side is stronger than this one. There's no pain, there's no discomfort necessarily. You just notice that one side is stronger than the other. Well, if you get that addressed, beforehand, obviously that's prevention. If you get it addressed before that becomes an injury, before you notice that you're compensating more on one side and there's overuse to that stronger side, then that's a great time to use it as a prevention.
Yeah, yeah. Most of the people that visit your facility, do they actually know what they want, or they just come up with a pain, and you guys are the ones that actually suggest the treatment?
So, I mean, ultimately, uh, our opinion is going to be valued most by the patient. There are patients who have experienced similar treatments in their past, or they're just curious and they want to give it a try. But ultimately, once again, we have to assess, we have to evaluate, and we have to determine what's going to be the most beneficial for that patient.
From the maintenance perspective, let's say an athlete, a gym member that is
Mhm.
healthy, is very mobile. How often do you foresee a person like this doing adjustment? Like once a month is enough? Twice a month?
So,
Just for maintenance, right? Just to make sure that things
right.
are operational correctly.
So, on average, you may see that's what we call a wellness patient typically. And on average, you may see them get treated once every 4 to 6 weeks. But once again, it depends on the individual. It depends on their level of activity as well as their frequency of activity.
Hmm.
A lot of times, no one really wants to stop what they're doing. They want to be able to continue to do it. And so, with that being said, we want to help them continue to be able to actively and effectively perform the best way that they can. And so, those people may come in more often than your textbook wellness patient.
Yeah, yeah. Do you also have dry needling there?
Yes, yes, we do.
Okay. And the dry needling that you use is also to for pain management, recovery. What are the most common cases that you suggest dry needling?
So basically, out of those, it's definitely beneficial to reduce pain in an area. Um, Also, if you have an area that's maybe once again not activating well or engaging well, it can help stimulate the area to where it is engaging properly.
You mentioned wellness type of client. Do you guys have like a package that you offer for clients that want to go like many times a month? Is a membership base or is it a visit base? How that works?
So typically it's per visit, but if someone would like to go ahead and pay up for sessions, we do allow that. But no, we don't have a membership, so to speak.
And although you are inside the hidden gem, you are open for everyone, right?
Yes. So we've had the opportunity to treat some members here. That's been a great opportunity for us. And then, some people that we may have known outside of here. We're really big on marketing on our social media page. And so we get a lot of people through there who possibly haven't been here before. And so, yeah, I mean, we're not closed off to anyone.
Okay, excellent. How it was during COVID? Were you guys fully closed?
So this was actually a business birth as a result of COVID.
Oh, really?
Um, yeah, absolutely. So Dr. Rocket and myself, we are classmates. We graduated from Parker University together.
Mm.
And long story short, I was let go from the last clinic that I was working at, and he was going through a transition with the clinic that he was with as well. And so he's like a brother to me. I was having a conversation with his mom, and she was like, "Well, why don't you guys do something together?" And I was like, "Well, yeah, I'll present it to him." And yeah, here we are. We came up with Ignite Health and Wellness, and we'll actually have been a part of Hidden on June 1st for a year.
That's amazing. So it was exactly because of COVID that you guys got together and put the business. Look at that. That's so awesome.
Absolutely.
And looks like the business is growing, right?
It is. As the days go by, just reflecting, that first day we were here, I think we may have seen one person, and just looking at how things are now. We used to be here 1, 2 days a week. Now we're here every day. It's definitely been a lot of growth.
That's absolutely outstanding. And it's such a good place to have this type of facility
Absolutely.
because as an athlete, there is always something that you need to do to improve your performance, or someone is coming out of the injury and want to speed up the recovery process. This is also a very common scenario, right? Someone coming
Hmm.
out of a surgery or injury and trying to get
Right.
back in the best performance.
Right. Right.
Yeah. And
Yeah.
is it based on schedule? You have to call and schedule time, or walk-ins are allowed?
So we typically do schedule based. We definitely prefer that, but at the same time, if someone does need to get on schedule and it's a walk in appointment and we're available, we may be able to accommodate them, but more than likely, it's best that you just go ahead and schedule with us ahead of time.
And to schedule, just go to the website or have to call you guys?
Yeah, so you could find our contact info on the Hidden Gem page. You can contact us on our Instagram page, our personal pages, and yeah, we pretty much just go from there.
Okay, cool. Just to wrap up, what would be your advice for someone that is very active? Because I think that this is the most common scenario at Hidden Gem, very active and but is not so into those techniques that you guys have. How do you educate this folks? How could you educate these folks to show the importance of this type of work to actually take that person to the next level on their fitness journey? Because I personally think is the work you do is very important to improve performance. It's not only about pain, as you said, many times it's
Absolutely.
about getting to the next level without having pain, right? So
Hmm.
what would you say?
So, just considering the body can definitely handle stress, but at the same time, there's only so much that is designed to take on. And the levels that we push our bodies to, in different sports and in different ways, whatnot, we have to understand that the body is breaking down over time, especially if we don't take care of it.
Mm-hmm.
And so, if you don't want to only enjoy those times of, heavy lifting and playing sports, whatever it may be, being active. If you don't want that to be short term, then you definitely need to be intentional about making sure you're, getting that self care, you're doing that recovery. Once again, although there is only a certain level of stress that the body is designed to sustain, if you do take care of yourself, it can be more of a tolerable experience, so to
Yep.
speak, and to where it doesn't have to break you down.
Yep.
You can still have a great quality of life as you enjoy doing the things that you do, um, and still get that self care to make sure that you can enjoy it. Because a lot of times, if you just look at different people in different sports, once again, those who are very active, the different aches and pains and injuries that they experience, a lot of times that's because you don't address the things that you need to.
Mm-hmm.
And so if you're not experiencing anything yourself, just look to the left and right, and surely you're going to know someone who probably could have had a longer lasting and more enjoyable career and whatever it is that they're doing if they would have just taken better care of
Yeah.
themselves.
It's what you said in the beginning, longevity. Make sure that you focus on longevity.
Hmm. Absolutely.
All right, Dr. Mark, thank you very much for your time. I appreciate you taking the time to record
Thank you,
this
Yuri.
episode. Keep up the great work, fixing everyone, and make sure that everyone is in the best performance. Congratulations for the business. Keep growing. You are in a great place, and I'm pretty sure that it will continue to grow.
Absolutely. Thank you, Yuri, for having me, and I
Absolutely.
appreciate it.
Thank you all for listening again. Make sure to subscribe to our channel on YouTube and subscribe also to the podcast on Spotify and Apple Podcasts. See you again next time.